Hi, Calvin. My name is Lisa, and I'm your occupational therapist working with you today. I am partnering with Dumpling, who's a respiratory therapist here in the ICU unit. I'm going to help you with activities that will promote your recovery and safety during your time here in the ICU unit. And I want to get started with assessing your current abilities and any concerns that you may have. During this assessment, Dumpling, I have observed his ability, mobility, strength, and ability to follow directions. And Calvin is demonstrating difficulties with transferring and following commands consistently, which indicates potential safety concerns during activities. I focused on discussing strategies to improve mobility safely and ensure his safety during self-care tasks. My question for you is, are there any specific positions or movements that we should avoid during therapy sessions to minimize the risk of respiratory distress or compromise his oxygenation? This information is going to help me tailor therapy activities to help his respiratory needs and ensure his safety during these sessions. Hi, Calvin.
Hello.
So today we're going to be working on an activity that will help improve your strength and endurance while also promoting relaxation and stress relief. Today's activity, we're going to be making a stress ball. I have some active materials over here on the table, bedside table. We have a balloon and flour, and we're going to use a funnel to distribute the flour into the balloon with my assistance. I also have a heart pillow here to help reduce any pain or discomfort that you may feel during your movements, because we're going to need to transfer you from the bed to a seating position so that we can start the activity. Okay? Wonderful. I have my notepad here, so if I pause for any reason, I'm just jotting down notes here. All right, so let me put this down. I'm going to give you the heart pillow to hold. Okay? All right, so during this transfer, I want you to slide before you hold the heart pillow. Let me get you to raise your legs and plant your feet in the bed. Then I want you to raise your buttocks up slightly and then slide over as close to the edge of the bed as possible to me. Great. Good job. All right, so now remember to use the bed rail. We're going to use your right hand, reach over, and then we're going to use that to help pull you up. That's going to assist you and make sure that you're safely making your movements to the seating position. All right, let's go ahead and drop your legs over here on the floor. Great job. All right, handrail and hold on to the heart pillow. I'm going to help you, and we're going to pull up at the same time on 3. 1, 2, 3. Good job. Okay, straighten up your legs here in front of me. You don't want to bend at any. Make sure you're holding on to that heart pillow. That's a good tool to have. All right, so make sure your feet are planted safely onto the floor, and then we're going to lean towards me, nose over toes, and on 3, we're going to use the strength of our legs to stand up. Okay? 1, 2, 3. Great job. Then we're going to move over here to the chair. And I just want you to just take a couple of steps over. We're going to back up to the chair so we can feel the chair at the back of our legs. Okay, we're going to use the same motion to sit. Nose over toes. Bend down and use the strength of your legs to sit down. On 3. 1, 2, 3. Great. Now, I'll take the heart pillow. Let me grab my notes here. And the materials here for you to use. I heard your favorite color was red, so I found a red balloon for you.
Great.
All right. So the first thing that we want to do is I'm going to assist you. So I'm going to hold the funnel while you hold the balloon. Let me put this here. Grab that there. And then, which is your dominant hand, your right or your left? Ah.
All right.
Okay. So, while I hold the funnel, we want to pour the flour down inside just as slowly as possible because it's a little ornery. when it goes down. Sometimes it gets a little stuck. If you want to stop and check and see the firmness of the balloon. Have you ever done crafting like this before?
I do it a little bit with my nieces and nephews every now and then.
Great. How old are they?
I got a few. I just can't think of all the names right offhand. Yeah, I love all of them,
They're fun, especially at this age.
Yeah.
This is a crafting activity that they can help you with, just in case that there's a little wear and tear with this balloon, or you want to change colors. Or maybe it's their favorite color.
I have them like both size.
You think you want to, is there enough room for more? If it is, if you have more room for a little bit more to make it firmer, then you can pour a little bit more in there. I think we're doing a pretty good job here. Good job. How's your hand feeling?
Great.
Okay.
This is like an exercise in itself.
Indeed it is. Do you think we have more room for more? Or we're pretty much
full.
done?
Yeah, it's pretty full. I don't think I can tie the knot.
Alright, I can assist you with that. Listen, don't forget to take those deep breaths and relax those shoulders. That's going to help with stress management.
Okay.
Okay? Alright, let's see. Oh yeah, that's a good amount. Alright, you think you can tie that? You've blown up balloons before?
Yeah.
Okay. Anything that I can do to help you?
I think I can get it.
Alright, let's see if I can help you with that.
Yeah, I can't get it.
Yeah. You want to stretch this down, stretch this part of the balloon down, and then I'll grab this.
Okay.
And then we can, I'll go ahead and twist and tie it. It can be a little tricky.
Great.
Alright, that's a nice size. Did a great job with that. Alright. Want to still remember to take those deep breaths for me, okay? And make sure that you relax those shoulders. You're going to take one deep breathe in. Now, how you feeling?
Good.
Pretty good? Great. Let me grab my notes here. And grab a pen. Alright, well, fantastic job on the activity. Now we can get you transferred back to your bed.
Okay.
So you can take you a nap and get ready for dinner.
Yeah.
I heard that you had some family members that were coming over.
Yeah, they're supposed to be bringing my favorite lasagna.
Oh, awesome. All right. What do you think about the activity?
It's okay.
Yeah,
I like it.
You want to play around with it and great job. All right, I'll take that for you and I'll sit this here by your bedside. I'm going to give you the heart pillow back
Okay.
as we prepare to transfer you back to the bed. We're going to do it the same way that we started. Once we get to the bed, we're going to use the handrail to get back into the laying position.
Okay.
All right, but the first thing we want to do is use our legs once again for strengthening. We want to go nose over toes when we are standing. And on 3, 1, 2, 3. Good job. And then we're going to just move towards the bed. Turn around for me. So you feel the back of the bed behind your legs. We're going to go nose over toes again on 3. 1, 2, 3. And then sit. Great job. Do you feel okay? We need to take a few more breaths before we lay down?
Yeah,
All
that
right.
was a lot.
So deep breaths in through the nose and out the mouth. Once again. Okay. How you feeling?
A little bit better.
All right. You ready to take the laying position?
Yeah.
Great. All right. So we're going to use the handrail again.
Okay.
We're going to use the right hand. This is here. All right, and then we're just going to lean over, and if you can swoop your legs around, I can help you. There you go. You got your strength in your legs now. We want to use all of the strength that we have in the strongest part.
Okay.
Okay? All right, then we're going to roll over.
All right.
Feet back up. All right?
All right.
I'm going to take this. And if you want to lift your butt up and reposition, slide towards me. All right, okay. Then you can lay down and rest. Well, Calvin, I hope that activity was fun. I look forward to meeting with you on our next session and bring another fun activity for you.
Great. See you then.
Awesome. Have a good one.
You too.